I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer, and I'm also the lead health officer for the Tri-County region, including Clackamas and Washington. And I'm increasingly speaking on behalf of the region for these briefings because we are really all working together. I have a few topics to just touch on in terms of where we are, and then we'll open it up to questions. Case numbers have been sort of up and down. In the most recent reports, it's a bit hard to interpret them because, again, of the testing result lag times, looking at both positive and negative tests that we use to track where we are and to inform our models. So it's hard to say exactly what direction we're going. What we do know is that hospitalizations are stable, and so that is good news. We also continue to see disproportionate effects on our Latinx community across the counties, and we're also seeing some communities emerge who have particular barriers, potentially around English speaking, access to healthcare, other reasons, and we're doing some very specific, culturally specific work there. I know there's always interest in contact tracing. This week, I wanted to sort of flip the story and really emphasize that most people do work with public health, and that's across the counties. Some of our cases we can't get a hold of because they don't give accurate contact information, sometimes out of fear, sometimes out of just a mistake, or for some reason we can't get in touch with them. But I do want to say that of the people we reach, the majority do cooperate with us. They want to do the right thing. Our contact tracers, again, across the region are skilled as far as many being bilingual, bicultural, and really being trained on how to work with people so that they know how to stay safe, how to let their loved ones and friends know about potential exposures so that they know what to be watching for. I also want to emphasize that our contact tracers will not ask people for money. They will not ask people for a social security number. If they will emphasize privacy, both of the individual and of all the details that we're asking people to share with us as far as their contacts. Finally, in terms of our messaging for the public this week, it's pretty similar to what we've been saying. We're still asking people to mask with anybody outside their household. And so I just want to be really clear, anytime you step inside anywhere other than your home, please put on a mask. And we need people to take leadership on this, to own this, and to really view it as a form of respect. To the extent that there are cases of virus that we're not picking up because people feel fine and don't know they have the virus. Again, this is how you make sure to show respect to the people around you, which is by covering your nose and mouth anytime you're indoors. And of course, if you're outside and cannot maintain the 6-foot distance. So also, again, want to reinforce our ask of people to really pay attention who they're spending time with. Again, the more you mix and the closer you mix with people outside of your immediate household, the more likely this virus is to spread. So just some examples from this past week, we've seen spread through wine tasting gathering, block parties, camping trips. And so we continue to see travel in the Washington, Oregon, Idaho states, and continue to see spread just from people moving around. So that's what I had prepared today. I also should say that another thing that has not changed is still seeing spread in younger people. Again, people in their 20s. I will share that Washington County is starting a region-wide social media campaign specifically targeting youth in their 20s with that campaign anticipated to start this week. So again, we are aligned across the region in our efforts. And I'll see if Lisa Ferguson would like to introduce herself and add anything.
Thanks, Jen. My name is Lisa Ferguson. I'm the Communicable Disease Manager for the Multnomah County Health Department. And I would just reinforce Jen's messaging, particularly around the fact that most people are speaking with our contact tracers. They are answering questions. We really reinforce privacy, and we do our best to talk through what it actually looks like, what the process looks like with each person so that they're comfortable and understand that. And generally, we do get pretty good responses from people. And also just to emphasize Jen's recommendation around masking anytime that you're inside anywhere that's not around, that's not within your own home. I think it's easy to be comfortable around people that you know and think that it's okay, but we really do recommend continuing to mask and protect yourself and protect those around you.
Thank you, Dr. Vines and Lisa. And now I think what we'll do is reporters should have the ability to unmute themselves and go ahead and ask questions. And then if there is, some detail that we don't have, I'll follow up with each of you. So go ahead, open it up for questions.
Dr. Vines, with the gathering on Saturday at the waterfront, the concerts, I'm just curious to know your thoughts on seeing the mass amount of people gathering there without masks, without being distant from one another.
Yeah, so it is concerning to me. The event you're referring to was brought to my attention in early August, directly from a community member. We referred on to the city around just with a heads up, and it really would have needed to be a permitted event, in which case we would have made sure to post prevention messages, reminders around distancing and masking. The event happened anyway. I do understand that people came from different parts of the region, that there was some reports of little masking. I don't know exactly. That is concerning to me. I will say that we have had assemblies of people on the waterfront for going on a couple months now. I think the most concerning reports I've heard of this particular event were that people were not necessarily maintaining the 6-foot distance, not masking, and potentially mixing, again, potentially intensely outside their household. So I think it does concern me as a potential event that can spread the virus. And again, if people have come from other places, we may or may not see an increase in cases that we can attribute to this event. As I've said with this group before, it can be very difficult to pinpoint spread to a mass gathering, even though we do ask about it.
Dr. Vines, any idea when or if Multnomah County might be moving to phase 2? Is that even on the table, or is that going to be, still a long way off?
Thanks for the question. I have not heard conversation about moving to phase 2. We talked last week about how Multnomah County is now on the state's watch list because of the number of cases that we can't trace to specific outbreaks or known transmission chains of the virus. I think especially also with the school reopening criteria, if anything, there's a push to think about how we can continue to limit spread. Again, calling on people to mask, to distance, and to work with our contact tracers if they get that phone call.
Hi, it's Amelia. You've mentioned camping, I think, twice now. And I'm just curious, it's an outdoor activity. I think it's something a lot of people in the Northwest think of as pretty safe. So what has the issue been there?
Yeah, I'll have Lisa elaborate on that. She's closer to these conversations than I am.
Sure. I think generally we agree that being outdoors is less risky than being indoors. What we do tend to see with camping is larger groups. And so anytime that you're having interaction between people, even if it is outdoors, especially where food may be shared and there's more potential for respiratory secretions to be exchanged in some capacity, I think it's easy to become comfortable with people that you know well. Even when you're outdoors, you can be close. So I think considering some of those things, that outdoors does decrease risk, but it doesn't completely eliminate it, especially if there are other routes of transmission where sharing food or other items like that could contribute to spread.
I guess I'm wondering, do you know how many cases have been connected to that kind of transmission? Just because we've heard, from other published studies, there's a lot circulating about how there are, virtually no outdoor examples of outdoor spread. So I'm just curious kind of how many cases that might be.
Yeah, I don't have an exact number, but again, I think it's less of the being outdoors and more about having that close connection with people and potentially sharing food and other items that could increase transmission risk. So I don't have an exact number, but I think what we are seeing is a lot of gathering, you know, and even outdoor parties when there's food shared and people standing close to each other, and not necessarily masking, that's where risk of transmission is higher.
Hi, it's Brad Schmidt at the Oregonian. It looks like the BIPOC population has had net positive cases above the white population for 15 consecutive weeks. I know that you guys have talked in the past about why you think that is. I'm curious if you see a turning point in the future where the BIPOC population is not making up the majority of cases, and if so, what would lead to that?
Thanks, Brad. I'll take a stab at that question and then I'll let Lisa answer. I think to the extent that people tend to socialize with people within their racial group, I think the concern is that the BIPOC spread is going to continue because of those social connections and because, frankly, of how segregated our society is. So I have that concern. I'm not sure, I'd have to think more about your question of what a turning point might look like and what would get us there. We are being very mindful and really doing our best to center Black, Indigenous, and people of color at the center of our response. So I think that we're constantly asking ourselves this question, but at least for now, when the virus gets sort of established within a community, it can be very difficult, I think, to turn the tide. And maybe Lisa has another take.
Yeah, I would say one thing you know, that we have been working on and continue to really work towards is resource support for people. And I think, you know, we work with different community-based organizations, many of which are culturally specific, to be able to help provide resources and some wraparound services through community health workers in the community who might already work with specific cultural groups. And so I think that is a way for us to then be able to make sure that people have resources, that they're able to stay at home in quarantine, they have access to food, they have access to housing if they need to leave their home or if somebody needs to leave their home to quarantine. So really continuing to build up those resources and make them available to anyone who needs them is one way that we're trying to make a shift in that.
Great. Are there any other questions that reporters might have around COVID at the beginning of the week?
Oh, it's Brad again. I'll just chip in. You know, the Mid-County area per zip code data continues to be particularly hard hit. It's a very diverse area, and there's a lot of cases there. What's the status on opening up the testing center in Mid-County?
I don't have current information on that. And Lisa, I don't know if you do.
Brad, this is Julie. I think that Kim Taves will be the source on that. And so that is something I'll try to follow up with you today on that, but she may not be back in till tomorrow, but we definitely will follow up with you on that.
Thank you.
I got one question kind of about the protest. Have you guys seen any, I know I've seen reports before that, you know, there's no cases or little cases tied to the protest. Are you still seeing that trend?
Correct. We still have no evidence of cases that we can attribute to the protests around Black Lives Matter.
This is Amelia. Nursing homes, particularly in Clackamas County, but in the entire Tri-County area continue to see outbreaks and cases, and at a much wider range of facilities than in the first couple months of COVID. And I guess, have you looked at how transmission is happening in those environments? Is there anything that you've learned? I think particularly taking a look at Clackamas County, any ideas why so many facilities in Clackamas County were hit in June and July?
So I'm not prepared to speak to specifics for Clackamas County. I can say that for Multnomah County, several of these outbreaks arose out of the testing mandate from the governor, and Lisa may be able to fill in more detail.
Yeah, given that we are seeing facilities testing much more regularly and testing all staff and residents, we're not surprised that that is identifying some cases. The good thing is that identifies cases early and allows us to make sure that, in addition to preventive measures that are already in place in long-term care facilities and nursing homes, that we are able to then very quickly make sure that additional measures are in place, like what we call cohorting, to make sure that anyone who's positive has staff only taking care of somebody who's COVID positive and not also taking care of COVID negative. So in a way, we see that as beneficial, that right now there's a lot of testing happening, and it allows us to increase our interventions early. And then there's additional testing that happens if people are positive in a facility, continuing ongoing testing of all staff and residents, so that we can again ensure that the right measures are in place in order to prevent additional spread. So while we are still seeing those nursing home and other long-term care facility outbreaks, we are seeing that many of them are remaining much smaller than maybe some of those earlier outbreaks.
So maybe one last question, if anybody has a question. And if not, we'll thank Dr. Vines and Ms. Ferguson, and Brad, I'll follow up with you. And thanks to you again for joining us on our Monday Media Avail. Take care.